I actually would say you have given the answer already to the question.
Yeah.
The biggest challenge is to identify people having diabetes in low and very low income countries, especially in rural regions. And the challenge following this is the resource allocation to develop and implement a healthcare system, healthcare management for those people. So this is really one of the big challenges today. Not in Europe, not in North America, but especially in Southeast Asia and in Africa in the upcoming years, because the number of people living with diabetes is constantly increasing, but the healthcare system is not prepared for this, or the healthcare system is setting different priorities. So the challenge from the diabetes perspective, or also we could say from the NCDA perspective, or non-communicable diseases, is that we diagnose, so that first that we find the people, then we diagnose the people, then we need an accessibility and availability of care. In many countries in the world, people with type 1 diabetes are not diagnosed. So now imagine we would improve strategies to diagnose them, but then they also need insulin, then also need care facilities and treatment. Often this also doesn't exist, especially in very low income countries, in rural areas. And finally, they need a follow-up. So you also mentioned prevention in your question.
Yes.
Prevention could be a way to address this challenge if the health policy in a state would focus on prevention of chronic diseases. We would lower the problem, but this is also often not done. So I don't want to criticize anyone because this is the change of our or the change of prevalence of chronic diseases at the end due to our lifestyle.
Yes.
But I think healthcare systems, governments, stakeholders, NGOs, global NGOs, as the International Diabetes Federation, have to respond to this and stimulate policy development. I have to respond to this and train healthcare professionals to become better in delivering care, but also have to respond to this and educate patients to improve self-management. So it would be good if we would now have 3 hours to discuss this, because there are a lot of very good examples coming from the member organizations, coming from the countries. But if we address this from an IDF perspective, we want to enhance the capability of responding to these health challenges, for example, by developing one international working group on fasting and diabetes. Of course, everyone in the moment is jumping on new medications and so on. They are much more expensive. This is a big challenge for low and very low income countries because it increases the cost for diabetes care by 20, in some countries 30-fold, which is not an option. Fasting and different styles of fasting can be an opportunity, and there is a group starting here at the Congress to assess all the evidence for fasting, 19 different fasting styles, and to translate this, how this can be used in type 2 diabetes care. Another one is type 5 diabetes. Yes, you heard correctly, type 5 diabetes. We could say we founded a new kind of diabetes here at the Congress, and this is a kind of diabetes which is very common in Southeast Asia and Africa. In the past, it was called malnutrition diabetes or malnutrition-related diabetes. Today, we would call it more a diabetes which depends on malnutrition of the mother during pregnancy, and then the offspring has less beta cells, will produce insulin, and has a higher diabetes risk. And this is a specific kind of form of diabetes and requires a different kind of diagnostic and treatment. And another group was working to start for or works over the next 1.5 to 2 years to develop a clear description, clear diagnostic criteria, and a therapy or therapy recommendation for this. Another initiative we are taking is artificial intelligence in diabetes. So how to use AI for improving decision-making for the physician or the healthcare professional, but also for the patient. So AI-based diabetes education for the patient. Let's assume that glucose sensors would be available soon for a very low price.
Okay.
It might disrupt our ability to deliver good diabetes care.
Okay.
And the International Diabetes Federation does everything to prepare the healthcare community to this challenge, always driven by the, let's say, mission to improve the quality of diabetes care for people living with diabetes, with special focus on low and very low income countries. This is a very important question, and the well-being in diabetes is the theme for World Diabetes Day for the next 3 years.
Yes.
So it's a period of 3 years where we want to address this topic. Why we have chosen this topic? It's because of quality of life. So well-being, this is very important to people living with diabetes, because if you have diabetes or if you have hyperglycemia, you often don't know or you don't feel it because hyperglycemia doesn't hurt. So, but the well-being, the quality of life may be affected by not knowing the diabetes or by knowing it and then with the treatment and with the measurements and so on. So if we are honest, for every one of us, for all the people living with diabetes, quality of life is more relevant than medical care of diabetes. But both of them is very strong connected. So we have chosen quality of life or well-being because it's the most honest indicator of our quality of life. And now we want to act to use the theme quality of life to generate awareness about diabetes, but also use interventions for diabetes or for diabetes prevention to improve quality of life. And you mentioned well-being and all aspects of mental disease.
Yes.
This is very relevant because if you have diabetes, your risk of having a depression is sometimes 3 to 4-fold higher. 75% of people living with diabetes experience burnout due to due to diabetes. On all these are aspects which are relevant for mental disease, mental aspects of quality of life. And I would say, as long as this exists, as there is burnout, relevance of depression, if there is stigmatization due to diabetes, we have not fulfilled our task, and that's why this is so important for us.
Thank you. And
let me add one aspect to in this year World Diabetes Day. So on 14th of November, it's more well-being and workplace. So it's a totally different theme, but it's exactly related to the same stream, because at the workplace, it's an environment, it's a setting what may enable us to diagnose or find people having diabetes risk or hyperglycemia earlier, but also to provide an intervention. You know? For example, the occupational healthcare system in many countries in the world is very well developed. In some countries, much better developed than the normal healthcare system. And the corporation or the state or the owner of the corporation is interested that the employees are healthy to work.
Exactly.
So this can be an additional trigger to build up a system of surveillance, of diagnosis, of awareness and intervention. And again, it translates into well-being. This is also a very good question. And the question has two aspects. The one is AI and the other one is digitalization in diabetes care. Myself and my research team in Europe, in Germany, we are extensively evaluating digital tools in diabetes care. The advantage is in Germany, digital tools for diabetes prevention and care are licensed by the health system or by the authorities. And what I always like to say is being in the pocket of every diabetes patient by using the smartphone. This is a big ability, a big advantage. Imagine every one of us is taking 1,800 decisions every day, and 450 of them are related to our lifestyle. Now imagine in the right moment, with the right motivational strategy, with the right content, a smartphone-based app sets impulses to influence only 10 out of the 450 decisions out of the pocket of the patients, but is doing this over the period of 1 year. This might be translated to 10 kilograms of weight reduction. So digitalization in the pocket of the patient can help to influence lifestyle, decision-making, self-management. It's the same as valuable for diabetes prevention and diabetes care. But now let's go one step ahead, and this is artificial intelligence. And we also, at this Congress here, we started a new committee on artificial intelligence and diabetes.
Congratulations.
Bringing all the evidence for AI and diabetes care together, because it's a very new topic. As you say, it's a hot topic. In the moment, is if you ask 10 experts, you get 15 different answers. What is AI? And we want to bring this together, driven by the goal to develop tools like digital apps in the pocket of the patient, to develop tools which go a step ahead, will bring together different data sources for people living with diabetes, assess this data, assess this information, and translate it into lifestyle intervention, decision-making, improved self-management, and up to recommendations for care for the individual or for the people living with diabetes. Now let's think even one step more ahead. Imagine that glucose sensors would be available to a very cheap price in the world. And I'm very thankful to the innovation coming from China, because this is in the moment the driver to lower the prices of available glucose sensors.
Honored to know that.
If we have a low price glucose sensor and use this also for screening, I think it will not be available in the next 2-3 years, but maybe after 3 years it might be possible. We learn so much about the lifestyle of the individual, or the patient himself learns so much. But then the question comes, what to do with this information? And here AI comes in, because AI can analyze glucose level, physical activity, mood, sleeping pattern, all this together. And it's not the patient himself who has to analyze. AI helps him to say, okay, this means risk, this is good, focus more on this. And I see a very bright future of applications like this, always again driven to address the need of the individual living with diabetes. So my dream would be having AI-based applications on the smartphone, collating all this data and translating it into lifestyle support or lifestyle coaching for the patient. And this would be the ultimate tool for a global diabetes organizations like IDF. I will do everything what is possible with a lot of commitment and passion and energy to reach this goal. We cannot be sure to reach this goal, but what we can be sure is constantly going step by step ahead in the direction to reach this tool or this goal. And I'm very optimistic that we have a very good future with all the attendees coming to this Congress, because at the end, they are the passionate people doing diabetes care. I have the chance as president to lead this, but the real leaders in diabetes care are the people doing on daily basis diabetes care. So a big thank you very much to anyone who is listening and is doing diabetes care on a daily basis. Thank you very much for your commitment, your passion, your energy. Thank you very much for your action.